bone is known as mandible or lower jaw. This is the only movable bone of our body. The mandible has two parts. This is the body of mandible and this is ramus of mandible. This is outer surface and this is inner surface. First, the body of mandible. The body of mandible has two borders. The upper border is the alveolar body to which teeth are attached, and this is the inferior border. At the inferior border, there is digastric fossa. Anterior belly of digastric muscles are originated. This is mental foramen through which mental artery and mental nerve comes out from the mandibular canal. This body of mandible fuses anteriorly to form the symphysis menti, and this elevation-like structure is known as mental protuberance. Inner surface, there are 4 genial tubercles, 2 superior and 2 inferior genial tubercles. 2 superior genial tubercles give origin to the genioglossus muscle, and 2 superior genial tubercles give origin to geniohyoid muscle. Geniohyoid is supplied by C1 root along with thyroid. One of the strap muscles is thyroid. Okay. At the medial aspect of this inner surface of mandible, this is mylohyoid line, which gives origin to mylohyoid. Below this mylohyoid line lies mylohyoid groove, which gives passage to nerve to mylohyoid and artery to mylohyoid. Nerve to mylohyoid is a branch of inferior alveolar nerve, and artery to mylohyoid is a branch of, again, inferior alveolar artery. This mylohyoid line divides the inner surface into two parts: antero-superior surface and posterior-inferior surface. In the antero-superior surface, there is sublingual fossa for sublingual gland, and in the posterior-inferior surface, there is submandibular fossa for submandibular gland. This is mandibular foramen on the two sides. Here, this is mandibular foramen. This is also mandibular foramen. These two are mandibular foramina. Now, this mandibular foramen gives passage to inferior alveolar artery and inferior alveolar nerve, which passes through the mandibular canal and comes out anteriorly through mental foramen. This mental foramen. On this ramus of mandible, this is anterior border, this is posterior border, this is inferior border, and this is superior border. This superior border is represented by this mandibular notch, which gives passage to nerve to masseter and artery to masseter. Nerve to masseter is a branch from anterior division of trunk of mandibular nerve, and artery to masseter is a branch of maxillary artery. To be specified, second part of maxillary artery. Okay. Now, this ramus of mandible has two processes. The anterior one is known as coronoid process, and the posterior one is known as condylar process, or head of mandible, or condyle of mandible. Okay. The coronoid process is triangular in shape. Now, I'll talk about muscles of mastication. The masseter muscle is inserted on this lateral surface of ramus of mandible. Okay. And on this condylar process, on the medial aspect, there is pterygoid fovea. Here, pterygoid fovea are present, at which lateral pterygoid muscle is inserted. At this angle of mandible, medial pterygoid muscle is inserted. In this coronoid process, the anterior border of mandible, tip of coronoid process, and some part of medial surface. And some part of medial surface of this coronoid process gives insertion to temporalis muscle, one of the muscles of mastication again. Now, okay, muscles of mastication is completed. Now, this anterior border, extending this anterior border, this oblique line. This is known as oblique line. Origin to muscle, buccinator muscle, not insertion. This oblique line provides origin for buccinator muscle. Okay. Most posterior part of this mylohyoid line gives one of the origins to superior constrictor muscles. This mandibular foramen is guarded antero-inferiorly by lingula. This lingula also gives attachment to sphenomandibular ligament, and this angle of mandible gives attachment to stylomandibular ligament. Both are false capsules of temporomandibular joint. Yeah, this is mandible.